to approve those minutes. Motion by Ed, second by Eric. All in favor? I'll get you the next time, Nancy.
Okay.
The next thing is the X-ray room and detector service contract renewal, service agreement renewal. Brenda, you want to say anything about that?
We did try to have Diversified, who is our biomedical company. We did try to have them give us a lower quote on it, but they said they were not able to because of the detector that we have. So they recommended that we go with GE. So this is the best quote that we can get.
Questions? I entertain a motion to approve the agreement. Motion by Nancy, second by Matt. All in favor?
Aye.
Opposed? Next is the Human Resources Management Plan. That was in your packet from last month. I'd entertain a motion to approve the Human Resources Management Plan.
So moved.
And
Motion by Tim, second by Eric. All in favor?
and
Robin,
Robin,
did you want to talk anything about that?
Okay, I was just if anyone has any questions. I mean, obviously, you guys have had a chance to read it. We've had a pretty exciting year last year in HR that culminated with us winning that Best in Class award for some of our benefit programs. We're working really hard this year to continue to improve a lot of the programs for our employees. So we're in the middle right now of changing record keepers for our retirement plan. We're looking at making some improvements to the dental plan, just different benefit options that we can give our employees. We've had a lot of strides in recruitment and retention over the last year. I did just have a couple fun facts to share with you guys. We currently, as you know, we're over 500 employees now, so we're around 530 employees. That's a little bit high right now because we have some of our summer students here, so that number will go down just a little bit, but we'll still be about 500. We have 35 employees who have been with us for over 20 years out of that number. 73% of our employees reside inside Greene County, and 27% are from outside of Greene County. We currently have 37 open positions posted. That's the lowest number we've had in the last several years. So as I said, we've made a lot of strides in that. And just we continue to try to make improvements in all of those areas. We also, my department HR, I have 2 staff members that work in there. We work on a variety of things in terms of regulatory and compliance issues. We also spend a lot of time on employee issues and working with employees on helping them resolve things that they have going on. So those are some of the highlights. If you have any questions, though, happy to answer.
Any questions for Robin? I just want to say I really appreciate what you do. I'm involved with the HR from the county, and
It is a job.
it is a job. Yes, to be polite about it. And you have a tremendous amount of patience, and way more than I have. And I applaud you for that. Okay, next we have the upcoming consent items, plans. They're in your packets. Please look those over and be prepared to vote on those next month. We still have our schedule of upcoming capital purchases, and I think those are both on hold for right now.
the e-bus scope we're actually evaluating. Dr. Trueblood had tried getting away with it. I shouldn't say getting away, but using a different type of scope while the e-bus scope was not available. It was on back order. It's now available again. We were evaluating whether or not we want to stick with what we have or go ahead and get the e-bus scope. There's some options to maybe buy a used one. So we're looking at that right now between how many cases he's not able to do because we don't have the more sophisticated e-bus scope. So that one is currently being evaluated by OR and administration. So we'll let you know on that one.
Review of the write-offs, Rebecca.
I think this month, the hospital is quite a bit lower, but I believe we did not receive
the list from our collection agency. I don't think they sent us that list. But even with it, I do believe we would have been lower on write-offs for hospital. The other two are pretty much standard, kind of where they are. They don't really vary that much on specialty. And my clinics, they are the smaller of the three. But the write-offs specifically to the hospital were quite a bit lower if you look at them this month.
Any questions for Rebecca? I entertain a motion to approve the write-offs.
So moved.
Motion by Tim, second by Nancy. Sorry, Nancy, I don't know what I got you. You raised your hand and I heard Tim, so.
It's all good.
A motion and a second, all in favor? Opposed? Admin report.
The first thing on here is multi-view. So with CPSI, we know that we have to switch out our financial management software because CPSI has put a sunset on their software. They're no longer providing support for it, so we have to switch it out. And we've kind of been procrastinating a little bit because it's been cost prohibitive at times. But we have been evaluating a new system. When it came down to it, the business office really liked multi-view, but this also includes the materials management software as well. Our materials management group liked Workday the best, and so we looked at it. Multi-view came for an on-site demo. Rebecca had the business office staff that would be using that come in and see the demo as well. They all really liked the multi-view system, and then multi-view kind of came at us with a surprise that they offered us to waive the implementation fee if we signed the contract by June 30th, and the implementation fee was $104,000. And annually it's $65,000. With Workday, it was going to be annually about $70,000, but the implementation fee was going to be between $150,000 to $200,000. So I did message with the executive committee and discussed it with them, and we decided to go ahead and move forward with the multi-view contract because we were able to get that implementation fee waived. So we did that at a executive committee level approval versus coming to the full board for it based on the cost, but it was because of that time crunch that they offered that deal for a short term. But really, I mean, this is the system that we all agreed with, we wanted to go with. Once materials management group saw multi-view had actually updated since they had seen it. They've updated to a newer platform. They're on a higher level technology, I guess a newer technology than even Workday was on. And then they were really pleased with multi-view as well. So I think it's gonna be a good system. We will begin implementation in January with go live scheduled for next June. So it's going to be a lot for the business office to transition over, but they will be doing, they will data migrate over 1 year. So we will have kind of the current year and then 1 year of in arrears that will be migrated over to the new system. So to be able to run some of the reporting like you were discussing, multi-view is going to have a lot more opportunity for the financial reporting and things like that we want to.
I think the best part of multi-view is if we would ever switch to the Epic version of Ocean, they will do that. They will not charge us to move to the other system. They will integrate with the new system as well. So that was one of the big keys for me, is that they played nice with both systems, the one we have now and the one we could have in the future.
And from the executive committee's point of view, whenever you can get what you want cheaper, we didn't think there was any way we could go wrong with that decision, so that's kind of how we based our decision. The hospital got what they want, it was cheaper price, so that's what we went with.
Some voice of the patient comments. I focused on surgery and ER from the Prescani comments. The first one is surgery. The hospital is so clean, which I think is a big compliment to our environmental services staff. They do a great job. We hear that often. For the ER, Paula was a great nurse. Student nurses Abby and Lucy did a great job also, very considerate. Dr. Gamble is so intelligent and such a good doctor. Nurse Ken was great.
Do we have 2 Dr. Gambles?
There too, yeah. It was the other one.
I'm just joking, Doc, really. I'm just joking.
Nurse Ken was great and helpful. Actually took time to listen to what had previously been going on with me, previous cardiac issues, etc. And ER also, Dr. Crane was very respectful and thoughtful. For opportunities, I will say on the ER this time too, ER is sort of your top department for complaints, just because it is. It was very hard to find negative comments in this. I think there were only 3 negative comments, and a couple of them were actually Press-Ganey had misread whenever it said, I didn't even have to wait. They misread that as being a negative comment, so it was really good. But one of the comments, this came from surgery, putting in an IV is difficult for me to have. I've asked for, but it was not available, a topical numbing cream before inserting the IV. I suggest this be available in the future. So that's a patient actually asking for something. I thought it was a good suggestion. And then I'm a bit more modest than some, and I was uncomfortable when the curtain wasn't completely closed. And I think it's good feedback for ER staff to always have that. It's an easy thing to forget. So I think comments like that are always good reminders to our staff. And then Jill's going to talk about patient experience scores.
This week we received our latest report about patient experience from the Medicare Quality Improvement Program, and it puts us at a 5-star rating. Most of the 5-star has to do with communication around nurses, discharge information, communication about medication. But the one I'm most happy about is we have been working for years to get willingness to recommend the hospital at a 5. And for some reason, people just weren't doing it. But we got it. We're a 5-star willingness to recommend. And 78% of the people who fill it out said they would recommend us. And that's great. We've been working on that forever. Pretty happy with that.
Good stuff.
Any questions on the admin report?
So you're gonna try and get the top cream?
Top cream for what?
The top.
Put IVs in.
Oh, yeah, I'm going to talk to the OR about that.
I was gonna say, that'd be good for kids too.
Yeah,
I mean,
yeah.
you know, whenever they've gotta come in.
Yeah, I thought it was a good suggestion by patients.
June financials, Rebecca.
You can see the numbers right there. We had 2 payrolls. This is one of the things that I think our admin team has been looking at, and will continue to look at. Making sure staffing is appropriate in every place and that we have the right number of people in the right places. Sometimes we can get a little skewed sometimes. Presentation of like the actual claims, the AP, that's pretty standard. That 991 in patient refunds, like I told you in the past, we've still not been able to figure out why all of a sudden we are getting our SNFs, our skilled nursing facilities, we're getting their payments. When we get those, we basically have to issue it through a patient refund. So that's why that's so large. It usually is not. The charge-offs are there, the write-offs are there. Cash is still really low. We are in the time of season, right? We don't have a lot going on at the hospital, or not usually. So we have that hitting. We had a number of different payments that had to go out the door. So our cash is really low currently.
This is when we always hit rock bottom because we paid out the retirement claims to our employees. We've done 2 bond payments.
The bond payments, yeah.
So this
There's
is
been a
our,
lot.
for farmers, this when the grain bins are empty, you know.
Ready for the next crop.
Ready for the next crop, yeah. But all the financial reports are there, and there is one on there, I think I have it on there, does it say hospital KPIs?
Yes.
So you were asking about KPIs. We do tracks. These are like I said, these are financial things that we look at. Salary costs, operating costs, the revenue, the net revenue and gross revenue, AR, like how's our AR moving? Different things like that. Days in AR is a big one for us to know how long it takes to go from start to finish on an account. So there's a lot of things on here that we track or that we look at each month. And if you notice, some of these actually go back 24 months, and I do that on purpose.
Yeah,
I do that for
think
2
you
years.
should. I mean, you should look at it for 2 years.
But what Brenda was talking about is it's kind of hard for us to use the system we have now to get this stuff easily, right? There's a lot of manual. We have to do this manually because we can't find this. We can't have this dashboard on the system we use now. We have to do this out of an Excel spreadsheet. So
That's a lot.
It's a lot, yeah.
Any other questions for Rebecca? I'd entertain a motion to approve the June financials. Motion by Harry, second by Nancy. All in favor? Aye. Opposed? Credentialing report. Dr. Gamble?
The credentials were reviewed by the medical staff and recommended for approval. It's a pretty big, long list as we change our radiology provider. So July 31st, we will switch from ClinRad Radiologist Group to the Summit Radiology Group. So we're credentialing all of their physicians, which is a
questions for Dr. Gamble? I'd entertain a motion to approve the appointments and reappointments, the credentialing.
I make that one.
Motion by Jimmy, second by Harry. All in favor? Opposed? Building and grounds, Rick's not here and Kyle's not here either, so I will give a little bit. We did close on the Guthrie property today, so it does belong to the hospital as of now.
Good decision.
And as for the ICU project, things are, paint, first coat of paint is on the walls. I think they've maybe even done a second coat of paint. Today they were installing the big glass doors that go in the ICU room, so those are being installed today. It's moving along really well, well on track for to have an October-ish start date. Everything kind of hinges though on that air handler getting ordered on time, or delivered on time, which it should be middle of September that the air handler will be there, and then we'll be able to finish it out and open.
I missed the last couple of, well, I guess we canceled a couple of the construction meetings, so wasn't quite sure where they're at, and I will miss this Friday's too, because I have another meeting that I have to be at. Finance and Planning Committee, Rebecca.
We did not meet.
Governance and Nominating Committee, Jimmy.
Nothing to report.
Hospital Foundation,
Did not meet this month.
medical staff report, Dr. Powers, do you have anything?
Nothing new to report.
Do we have any public comments tonight? I don't have any old hospital business for discussion. I don't have any new hospital business for discussion, so I'd entertain a motion for affirmation of the executive session. No decisions were made. Motion by Harry, second by Tim. All in favor? Nobody has anything else? All hearts are clear. I'd entertain a motion to adjourn.
So made.
I got several motions. One by Ed, second by Harry.